All right, good evening, everyone. And I'm saying good evening because I'm joining from Lagos, Nigeria. And it's my pleasure to welcome us to today's conversation. In fact, it's a conversation we have all been waiting for and we're excited to have. My name is Chidinma Nwobi, and I am the co-founder of She Reconnects Africa. And we are delighted to be doing this in collaboration with the Medical Women's Association of Nigeria Lagos branch and the Medical Women Association of Nigeria National Outreaches and Community Engagement Committee. It's our pleasure that we can have this forum with experts who would speak to us about things that pertain to us as women. So She Reconnects is just that tribe of African sisters. The important thing is that for you to be a part of us, you need to be African and female. And it doesn't matter where you reside anywhere around the world. And what we just do there is share knowledge so that we can, first of all, connect with our sisters, share compassion and courage, and reconnect to our core African heritage. All right, so that's what we do in a nutshell. So usually we have a community where we have a monthly team. So in the monthly team, we discuss it Monday through Fridays, and then we have webinars once at the end of the month. And there's something else we do that I love the most, and it's the Courage Chair. The Courage Chair is that opportunity where a sister voluntarily sits on the Courage Chair and shares maybe a struggle she has been through, and how she triumphed through it. Then other sisters get to ask questions and also tap for my resilience. Anytime we have that session, people are always leaving encouraged to know that maybe sometimes you feel that your suffering is just limited to you, but when you hear another person's experience, it kind of strengthens you, not because you're happy, your sister struggled, but there's that sense of shared human suffering. So you're welcome. So let's get right into the business of today. Like I said, we're not doing this alone. We are collaborating with the Medical Women's Association of Nigeria. And just to recognize the key officers who have collaborated to make this possible, I want you to just send a virtual cheer, maybe a thumbs up, even as I recognize the key officer. My co-founder, Olabuku Imokwede, will be joining us soon. We both founded the She Reconnects African Tribe 2 years ago. And interestingly, October is our anniversary. So we get to share our anniversary with you. I want to recognize Dr. Ime Okon, the state president of the Medical Women's Association of Nigeria Lagos branch. She has been phenomenal, talking back and forth about the resource person, about how we want to make today great so that people live here with tips that can better their lives. In fact, maybe I should add that I'm currently 48. So I'm in the league of the people who need this knowledge. Because perimenopause has shown me basbos. My husband had to go and start a research to learn how to handle this perimenopausal woman. So I'm glad that we can do this. Thank you, Dr. Okon, for doing this with us. Next, I want to appreciate also our guest speaker. I see she's running home to be seated and give us a great time. So Dr. Modupe Adedeji, consultant, obstetrician and gynecologist, Lasut Ikeja. Thank you for choosing to do this with us. Is there any state chapter of M1 in the national city? I would also recognize Dr. Zainab Kwaru Mohammed Idris, who will hear our voice in a bit, the national president of the Medical Women's Association of Nigeria. And lastly would be our own She Reconnect's sister, who is also the chairman of the M1 National Outreaches and Community Engagement Committee. Thank you so much for this partner. We're going to have a great time, and all of those are troubling questions about perimenopause and menopause will be answered today. So just to get us to the next stage, I will be inviting Dr. Ime, the state president of the Medical Women's Association of Nigeria, Lagos branch, to just give us a brief opening speech. Dr. Ime, you have the floor, please.
Good evening, everybody. Can you hear me?
Yes, we can hear you clearly. You're welcome, ma'am.
Thank you very much. I don't know if our national president is online already because she's meant to go in for another meeting. So I would have loved maybe she speaks first so that please, I don't know, is she online? Dr. Zainab?
All right.
If she's not, then
Dr.
I can go
Zainab,
ahead.
is she
Is
here? I can't.
Okay.
Please go ahead.
All right.
I will check. Please go ahead. Whilst we
All right.
Yeah.
All right, thank you. Thank you very much, Jima. Thank you very much. Distinguished colleagues, all the members of She Reconnect Tribe, right? I got that. Our partners in this, the members of the National Committee on Outreaches. I recognize my national president and other people from the National Committee on the call. Our very esteemed resource person, our own Dr. Modupe Adedeji, also known as Dupsy the Gynae, and our own very distinguished secretary of our Lagos State sector of SOGON. SOGON is the Society of Obstetricians and Gynecologists of Nigeria. Our invited guests and all the participants joining us from across Nigeria and beyond. Good evening once again and welcome to this webinar. It gives me great pleasure on behalf of Medical Women's Association of Nigeria, Lagos State branch, to warmly welcome you to this very important webinar titled Navigating Perimenopause and Menopause in the Black Woman. Today's conversation is actually significant. In fact, very, very significant. People just grow and they observe some things happening to them and they wonder what is happening to me. I get irritated easily. I just notice feeling hot and cold at the same time, and so many other things. And they keep wondering what exactly is happening to me. Am I normal? Perimenopause and menopause are natural transitions in a woman's life, yet they remain heavily under-discussed, frequently misunderstood, and often burdened by stigma, cultural silence, and misinformation, particularly in our Black communities. Can you hear me, please? Am I still breathing? Hello?
Go ahead,
Okay.
please.
Okay. Many women are left to navigate these changes without adequate knowledge, without adequate support or access to evidence-based care. This shouldn't be our reality. As a responsible association dedicated to the health, empowerment, and well-being of women at every stage of life, M1 Lagos considers it a primary responsibility to create safe, informed spaces like this, where science can meet live experience, where knowledge empowers, and where we reaffirm the dignity of womanhood in all the faces. And that is why in less than 2 weeks of coming on board as a brand new ESCO, our team decided in collaboration with M1 National Committee on Outreaches and Engagements, we quickly reached out to our sisters at the She Connect Reconnect tribe, and we agreed that our women shouldn't suffer for lack of knowledge and awareness. Today, our expert speaker will shed more light on the physical, emotional, hormonal, and social dimensions of perimenopause and menopause, debunk the myths, discuss culturally relevant approaches, and equip us with practical strategies for supporting ourselves, our patients, and the women in our communities. I hereby encourage everyone to engage, ask questions, use this session as a springboard for broader conversations in your homes, in the clinics, in the churches, August or November or Christmas women's meeting, wherever we can find women, workplaces, and other networks. Because when women are informed, they thrive. And when women thrive, families and societies grow stronger. I appreciate our speaker for accepting our invitation, even at a very short notice, as busy as she is. Even when Sogon is holding their conference and she was partaking, I think they just finished yesterday or this morning. I want to thank her in a special way, and our partners for their dedication, all attendees for investing your time in this vital dialogue. With great pleasure, I want to welcome all of us to this webinar and say thank you very much. You are welcome. Thank you. Dimma, over to you, please.
Thank you so much, Dr. Ime. Thank you so much. And we cannot but thank our guest speaker. I can just imagine jumping from one conference to this one. That is a huge sacrifice. So just to reconfirm, please, is Dr. Zainab in the house yet? Okay. All right.
Yes,
so the moment when Dr. Zainab, please, can you turn on your video so that I can see you and bring you to the spotlight?
Yes, thank you very much.
Hello, ma'am. It's your video. Okay, hold on. I want to locate you. I'm trying to look for your face so that I can spotlight you.
I'm here. I've joined.
Okay, what's your screen name? If you want to confirm, what's your screen name? Or do you want to just speak off camera? I would like to see your face, ma, because I want to bring you to.
Yes, Zainab.
I'm trying to look for Dr. Zainab. Okay, let me go down. I'll find you. Okay, go ahead and speak, ma'am. If I find your video, I will spotlight you. I'm really trying to find your screen name so I can bring it to the spotlight, but I can't see. Okay, I've seen you now. Fantastic. Okay, ma'am.
All right. Thank
Please
you
go
very
ahead.
much. Let me start by aligning myself with all present here tonight. The organizer of this webinar, my sister, our president, M1 Lagos State, our distinguished colleagues, our esteemed guests, and dear sisters. I'd like to say a very good evening and to also lend my voice in welcoming all this very important and timely webinar. On behalf of the Medical Women's Association of Nigeria, it is my pleasure to convene to also participate in this conversation, which centers on navigating perimenopause and menopause as a black woman. I think that's the topic. For us, this topic is really very timely because it touches the lives, the health, and the dignity, as well as the well-being of millions of women across our communities, especially the Black community, our society. And we know that even though menopause is a natural transition, many of us Black women it's challenging because it is accompanied with unique challenges, especially those symptoms that often start early for some, and for some it becomes very intense. And sometimes people that do not have the knowledge, they are clearly misunderstood or dismissed for some of these experiences that they present. And then cultural silence, stigma, and then limited access to accurate information can leave many women navigating this phase of their lives alone. and in very much pain. So today, choosing this topic is very, very significant because it's a path that seeks to inform or rather empower women with knowledge to also create space so that we are open about the conversation and it empowers the women that actually undergo such experience. I believe that this webinar brings together experts. I'm happy that our speaker, in the person of Dr. Modupe, if I'm not mistaken, will do justice to this subject matter. And I also believe that participants or the audience in this meeting will do a lot to ensure that we also learn from what she's here to present to us today, especially in debunking those myths, highlighting the culturally relevant care that is needed, and then strengthening our support system to be able to address this issue in a woman's life. So the goal is simple, is to ensure that every woman enters this phase of her life with confidence, the clarity of purpose, and also with empathy and compassion. As M1, we remain committed to championing these causes, women's health across the life course, right from adolescence through the reproductive years of their lives, and of course, into the midlife and beyond. So, this conversation for me is going to be very helpful as it will break down those barriers. It will help us to uplift one another and also promote equitable and evidence based care for all women. So, thank you for inviting us. And I would like to lend my voice and hope that we continue to prioritize these issues that affect us and our colleagues and our sisters that enter such stages of their life. So I wish us a successful webinar, and I hope that at the end of the day, we'll get enriched and it will be empowering for all of us. Thank you very much, and have a pleasant session ahead. Thank you.
Thank you, Dr. Zainab, and thank you for making our time to, join us. When we see all of you here, we know that this is really something very important, and we are encouraged by time. Thank you, and enjoy the rest of the day. Okay, so I hope that we have started putting down our questions, because I said to Dr. Ime, I want people to be able to ask their real challenge question. So please start gathering your questions, because right about now we are calling our guest speaker. But I will be inviting Dr. Faith to do the honors of reading the citation of our very robustly trained and experienced guest speaker. Dr. Faith, Secretary M1 Lagos Branch, please do us the honors of introducing our guest speaker.
Thank you very much. Good evening.
Good evening.
Thank you. So it is with great pleasure that I invite the guest speaker. Our guest speaker today is Dr. Modupe Adedeji. She is a prominent Nigerian consultant obstetrician and gynecologist, known for her medical practice and media presence. She's also recognized as Secretary Southern Lagos Sector. She is an experienced consultant, obstetrician, and gynecologist with over 15 years of experience in the medical field. She specializes in pregnancy and female reproductive health, including sexual health and cancer screenings. She holds a Bachelor of Medicine, Bachelor of Surgery, and she initially studied biochemistry at the then Ogun State University, now Olabisi Onabanjo University, before crossing over to medicine, where she excelled indeed. She works as a consultant at the Lagos State University Teaching Hospital, LASUT, and consults at J.A. Lashma Hospital in Agege, Lagos. She is also actively involved in medical education and clinical research. Beyond her hospital work, she has moved into the media space, where she actively unbottles myths and misconceptions about common gynecological conditions and practices to raise awareness about women's health. She uses a social media handle as Dupsy the Gynae for public outreach. Distinguished ladies on the call, join me to welcome our guest speaker for today on the Menopause Lecture, Dr. Modupe Adedeji, Dupsy the Gynae. You're welcome, ma. Thank you very much.
Thank you, Dr. Faith. Please, I need to see the chat room buzzing. This is that we have been waiting for. It's time to get those questions. In my head, I'm saying, maybe we should have even invited the husband self so that they will come and know what is going on with their wives. Let's leave them. Let's do women talk now. So I'm yielding the stage over to Modupe Adedeji. Ma'am, you're welcome, and we are excited to have you. I can see you are still commuting back home, but thank you for doing this with us. So where you are at, can you share your slide, or would you want me to help you to share the slides? What would be more appropriate?
Yes, I will appreciate you share the slides. I'm still on the road, but I really apologize for this. It's just like saying Nigeria has happened to me today. I felt I could make an hour or two journey from Lagos to Shagamu and back. But unfortunately, I've been on the road now for over 6 hours just to navigate between Lagos and Shagamu and back. So I really apologize. So I will appreciate if you can help share the slide. So while I wait, thank you for the introduction. Thank you for the glowing introduction by Dr. Feto, the Secretary M1, and also to my president, Dr. Okon. And I thank you so much, She Reconnects, for having me. And I hope to try to lift up our knowledge more, because I know most of us are doctors on the platform. But yes, I know the link has also been shared publicly, so I'm sure there are non-doctors as well on the platform. This is actually a very interesting topic, and I noticed that this topic has been flying everywhere, especially in the social media space.
Dr. Modupe,
hello,
please don't treat us as
are you hearing
non-doctors.
me?
Forget about your colleagues that
Yes.
Most of us are not doctors, so bring it to layman. Don't assume that we are in the medical field. So give us layman terms so that we can understand, man.
Yes, that's what I'm doing. That's what I'm doing. So that's why I'm actually also acknowledging non-doctors on the platform as well. But I want to be sure if I'm very audible. Am I audible?
Yes, you are audible. I can hear you clearly.
Yes, you are audible.
Okay. Thank you so much. So I've been asked or called upon to discuss this topic, navigating perimenopause and menopause as a Black woman. Yes, thank you very much. Can I go to the next slide? And my face is well represented there on the first slide as a Black woman, obviously. And I also happen to be around this age where we tend to start experiencing this transition. I actually started preparing for this around about 6 a.m. this morning, only for me to be in front of my laptop that I should rush the presentation and start my day. And then I just saw the time that it's about 8 p.m. that it's going to start. I thought it was 8 a.m. And I had to reach out to the president, Dr. Okon, and she said, yes, seems as if I've started displaying one of the symptoms of perimenopause, menopause. So I said, yes, obviously. So this is my outline. And I'm going to ask, what is perimenopause or menopause? Does it matter? Can I cope? What are symptoms and signs of menopause? What can I do? Do I need treatments? Are we talking about lifestyle modification? Is it part of aging? And then I'll be concluding. Next slide, please. Next slide, please. So what is menopause? A point in time when permanent cessation of menstruation occurs following the loss of ovarian activity. Greek word men Months means months, and then pauses means cessation. Menopause is the end of menstrual cycles, not a menstrual cycle, but rather menstrual cycles. Menopause usually happens around the age of 45 to 55 and averagely 51 years. So it is pause. And what it just means is that the follicles within the eggs have been within the ovaries have been exhausted, because it is the ovaries, the follicles within it, that determines ovulation and eventually menstruation if there's no pregnancy. So it's important to make mention of some terms relating to menopause, starting with perimenopause. It's the term used to describe the changes you go through just before or after you stop having your period, marking the end of one's reproductive years. So peri means around. There's a particular age when it will eventually stop, but before it, definitely there will be some things that will be occurring. At that age, when it stops, what you experience basically is that there is no more menstruation. And subsequently afterwards, for a period of 10 to 15 years, definitely there will still be some things that that is happening to you. So climacteric is the period of time when a woman passes from the reproductive stage of life through the perimenopausal transition and then to menopause and thereafter post-menopause years. So climacteric is a Greek word for. So hello, I'm back.
Dr. Modupe.
Yes, I'm back.
Okay,
I'm back.
great.
So
Go ahead, ma'am.
I'm almost to my destination, but just bear with me for this period. When you go under the bridge, the network tends to disappear. you know. Okay, so I just finished talking about climacteric that I said is a ladder of life. So there's stages. You just climb up the ladder and then up to its very end. So premenopause is what mentioning, haven't described what climacteric and perimenopause is. That is the years leading to menopause. And postmenopause is the years after, less than 10 to 15 years. And then early menopause having been between 40 years and 45 years old. While premature menopause is also worth mentioning, which can happen before 40 years. I've actually had patients that had to get into menopause at the age of 30. You can imagine that. And as I've said, it means the productive life is over. One can never get pregnant spontaneously anymore. Next slide. Next slide, please. Okay, so the age related to ovarian follicles. Yes, on my left is age, and then on the right is the number of follicles. At birth, one is born with 1 to 2 million follicles. That's eggs in the ovary. Initially, even with in utero, these numbers of follicles are much more. But by the time one gets to puberty, one will realize that we have 300,000 to 500,000 follicles left. When I'm saying follicles, I mean eggs left within the ovary. And these are because of some of the processes occurring at that very much in time. In fact, when you do a scan for a baby, the ovaries are actually much more obvious, even more than the uterus within that time. But as one gets to menopause, the numbers drop from 300 to 500,000. And that is exactly the numbers that you are going to have in the course of the reproductive life, of which you are going to have to be wasting about 10 or more of these follicles month in, month out, or circle in, circle out. By the age of 37 to 38, one has 25,000 follicles left. And that is why the word elderly primigravida comes in, of which we now call older primigravida. because at this point in time, it seems as if it doesn't get quite easy to get pregnant easily. And obviously, by the age of 50, you have just 1,000 or less follicles left. And we cannot vouch about the fact that these follicles are good enough to get pregnant. Next slide. Okay. Does it matter actually to become menopause? Does it matter? Yes, it does, because it is just natural. It is a natural thing to happen. I hope I'm very audible.
Yes, you are.
Hello?
Yes, you are. You
We
are
can hear
audible.
you. Go ahead.
Go ahead. Yeah. Thank you so much. Can you see those beautiful ladies at the corner? Those beautiful black women. So because it's actually very natural, and it's one thing to be excited about, one thing to be happy about. Fact that one is maturing, one is aging, and the fact that achievements obviously are being done, and you're counting your achievements and all that, and it's even a time to recall, of one's life. So it's actually natural, and it's part of nature, so to say. Women are born with all their follicles, which are stored in their ovaries. The follicles make the hormones estrogen and progesterone. This is trying to convince us why it really does matter. The hormones are in control of menstruation and ovulation, which helps to release the eggs. So menopause happens when ovaries no longer releases follicles regularly. And that's when they don't release regularly. We are now talking about the fact that something is about to happen, which makes reference to premenopause and also perimenopause. The follicles are then eventually exhausted, and that marks menopause. So it's not something to be anxious about. It's something that one should take in as a natural process. Next slide. Next slide. Can I cope? Can I really cope with menopause? The answer is a big yes. Menopause is a normal life event. It's not a disease, never. It's not a signal of impending decline, rather a wonderful phenomenon, and can signal the start of something positive. New life with a good health program. Really, that is how we should take it. Menopause is a normal life event. It is not a disease at all. It is physiological, as we say as medical people. We say it is normal. So it's not something to be worried about. It's not something to be scared about. Now that we are even having a loud discussion about it, because when you go through social media and all that, you see so much discussion around it. Some people I know will be wondering, why this noise? Why this discussion about it? I don't have any worries, but rather we need to talk about this and make this very loud, because there are some people that are actually feeling the effect more than necessary. It just relates to also how we span through our reproductive life. Some people have it very easy with menstruation. Some don't even want to see their menstruation coming, because it's actually something that may they take in. It's not easy to take it in every month, coming from the symptoms. So these are the very issues that can happen to different women, and that's why it is important to still talk about it. And we are supposed to also know, even if we're not coping, what are the methods, what are the ways by which we can cope with it, when eventually at the end of the day, not that we'll get used to the situation, but it eventually wears off. Next slide, please. What are the other options with menopause? Other options with menopause. Yes, menopause at times may not be physiological. That is what we're saying. It can actually be man-made because of one issue or the other. For instance, from medications. Gonadotropin releasing hormonal analogs, which are one medication that we use to treat some form of gynecological conditions, can actually bring about menopause. Because what it actually does is to shut down the ovaries and prevent ovulation from occurring. You know, the eggs might be there, but then when they are not coming out, obviously that means that there will not be estrogen, and the estrogens will be reduced, and they will not come out. And definitely, symptoms of menopause can supersede this. Most of the time, we tend to use this medication in the management of fibroid, We use it now also in the management of endometriosis and the likes, So these are very important things that we should know. At times too, we need to remove the uterus. That's hysterectomy. There are varied reasons why we remove the uterus. When we are removing the uterus, we are talking about also taking out the ovaries along with them. Yes, this can even happen quite early. Yes, we have very young children. I mean, the Ghanaian oncology units in Lasut. And at times, we have very young girls that come to us with cancer. Cancer, we know what cancer is, and it may mean that our decision may be to remove the uterus and to remove the ovary. Well, that is quite pathetic, but then we also have the issues of ovarian cancers in our older women, especially women who have never been pregnant or just have one or two pregnancies, and these things run in such families. But then we have to remove the uterus along with the ovaries. Obviously, that means the patient may have menstruated last month, and getting out of that theater, she will never menstruate again. So that is a sudden menopause. We have suddenly pushed the patient to menopause, all because of the ailment supersedes its bad that of the fact of pushing her into menopause. So patients on chemotherapy for one cancer treatment or the other, or chemo or radiotherapy, may also have a form of ovarian shutdown, wherein the eggs are not coming out again, they are not being functional again. So these are some of other reasons why menopause can occur. Not that that came naturally, but it came as a result of certain management of one disease or the other. So premature ovarian failure is something we should also discuss, which I mentioned earlier. It's occurring before 40 years. This is not man-made, rather also natural, but occurring early. Yes, we have it occurring. I was saying that as women, when at puberty, we have follicles ranging between 300,000 to 500,000. So that means some other women could actually have less of this amount. And before you know it, they are clocking before the age of 40. You ask them to do an hormone profile, you just find out that the luteinizing hormone, LH, and the follicle stimulating hormone is high up in the sky. And unfortunately, because of the education that we embrace so much in this part of the country, the patient may not even have gotten married, has never been pregnant at all. And then we have to announce to such patients that they are now menopause. Next slide. So why stopping? Why is it stopping? Is it because my curiosity is killing my cats? Yes. These are highlighting some of the questions we ask, especially in that case of my menopause coming quite early. You want to ask certain questions. Is it because I smoke? Huh? No, that may be actually no. Is it because I have low level of education? I don't know what I'm supposed to have done. I don't know what I should have been eating. I don't know what I should have read about or something. Obviously, no. These are highlighting some of the questions resulting into myths of menopause. I am of a lower socioeconomic class. That means I don't have money to eat well, or I can't take care of myself. Obviously, no. As I've said, menopause is a natural process, And is it because I live in high altitude environments? Yes, that's a yes for that. People who live at high mountainous areas tend to experience earlier age at menopause. And then with the use of oral contraception, does it mean that I will attain menopause earlier than others? Obviously, no. It is absolutely no. I've talked about the numbers of follicles that we usually have, and then those follicles have to be exhausted before we talk about menopause. And then we talk about querying alcohol. Is it because I consume alcohol as one of the reasons that menopause could actually come earlier than expected? So I'm sure there are other whys that we want to ask. And I'm happy that the hosts have said that we should put our questions down. So I'm expecting a lot of questions. Thank you. So what are the symptoms and signs? Basically, we are talking about what happens when we are estrogen deprived, because as soon as the follicles are reducing or being finished, the estrogen drops because they are the master producer of estrogen. That's the hormone that determines and actually helps us that defines us as a woman, So they come with their issues. Even though these estrogens may be produced in other parts of the body, but the major powerhouse of estrogen production is from the ovaries by function of the activities of the follicles. So one of the issues that we'll feel, signs and symptoms, is disturbances in the menstrual pattern. There will be irregular menses, which usually precedes menses. Yes, I mean, which usually precedes it stopping. That's menopause. You just notice that your menses, which earlier has always been regular, you can predict when your next menses should come, and then you now start seeing that you are having some delays in the next menstruation, like that and all that. And before you know it, it's getting to 3 months, 6 months, and then eventually a year. When one is amenorrheic for a complete 1 year, that is when we actually make the definition of menopause. If you come to us and say that your menses is still occurring about 3 months ago, you still saw it, we may just tell you that you are still perimenopause. It has to be 12 months of not seeing menstruation before you start talking about menopause. So vasomotor instability are the other issues, and that includes the common popular estrogen, hot flushes that we talk about. It's important for me to explain what this hot flushes is. Hot flushes is actually this feeling of heat that one feels internally, and it usually starts along the belly button, and then it goes right then to the center of the head. You just feel that heat, and the next thing is that having gotten there, you just sweat out, irrespective of the temperature of the day or wherever you are or the room you are in. You'll be wondering, it's not hot in here, and then you may want to ask question, is there any other person like you feeling as hot as you feel? And by the time you just move close to a fan or something, you feel so soothing with the sweat and all that. So that's one of the vasomotor instability that occurs during perimenopausal period. And then we also talk about a lot of sweat at night. Yes, night sweat. It's not because you have tuberculosis. It's just one of the signs and symptoms of deprivation of estrogen as a result of perimenopause. Then there are atrophic changes that occur. Atrophic means some form of dying off of the cells. For instance, we have vaginitis usually occurring as a period where one can start feeling some form of funny dryness in the vagina, and then alongside at times even discharges. That's vaginitis, because the pH of the vagina tends to be higher at this period. We expect a slightly acidic pH in the vagina, which helps to keep infections away. But at this time, it becomes alkaline, and then because of that, little infections can definitely occur because of that. Then there's urethritis, recurrent urinary tract infection. It occurs at this period, which leads to urinary frequency, even incontinence. Incontinence means that you cannot keep urine. Once you laugh, you just see that some drop of urine goes into your panties and all that. And then the urethra can also extend outward, like it's called a coruncle. Then you just feel that there's some small mass around the outlet of where the urine comes out from. All of these things are not things we should keep to ourselves. It's important to come to the clinic, and then we'll be able to separate the fact that it is the normal signs and symptoms of menopause are not exaggerated into a symptom or into a condition that needs to be treated. Health-related issues due to long deprivation of estrogen include the presence of osteoporosis and even cardiovascular diseases. When we talk about osteoporosis, that means there's decrease in bone mass, yes. And as a result of that, there's back pain, there's tooth loss, yes, and there's decreased height and mobility. Our tall mothers, you see them bending, their height reducing, and simple fall can just cause a fracture. Yes, it's because the estrogens also contribute a lot to bone density. Then I talked about cardiovascular diseases like coronary heart disease due to high cholesterol. Next slide, please. Next slide. Hello, am I audible? Next slide. So other conditions include sexuality and menopause. Reduction in the rate of production and volume of vaginal lubricating fluid, obviously. Then there will be loss of vaginal elasticity and thickness of its lining. Vaginitis, pruritus, dyspareunia, that means pain at sex, and stenosis. And then there's also loss of libido. You are not interested in having sex with your husband again. And I agree with one of the, I think one of us mentioned that we should have also introduced, we should have also brought along men into this forum, yes, so that they will understand really what is going on. And then there's reduction in the breast size as well. So all of this shows the sign of disinterest in sexual intercourse. Then the mental health too is affected just because estrogen is deprived, there's deprivation of estrogen within the body. There will be mood swing, there will be depression, deprived sleep, that's what we call insomnia, and there's adult dementia, you cannot just remember things again. And it can actually go to the extent of pathology. That means it's raised a lot of concern that you just keep forgetting things, you can't remember things, you are just shocked. And what's happening to you? And obviously, there is something we also call Alzheimer's disease, which also is one of the mental ailments and encompasses dementia, and all that goes with it. Then weight gain, yes, especially truncal obesity at this period in time. So you can see that estrogen on itself has a lot that it does to the woman in the reproductive age. So what can we do? Yes, see your doctor to confirm your thoughts. I've emphasized that. Doctors will have to check out what is happening, starting by taking history and examining, and then they will also want to do your hormones. I'm happy that I can also speak against hormone imbalance. I hope we're not one of the people that usually say there is hormonal imbalance. Please, I really need us to take that out of our vocabulary, because with hormones, we look at the hormones and then we look at what volume they have, so to say, their concentration in the body. And then we pay particular attention to this hormone. It's not that it's imbalance, as people usually say. I don't know where that word came from. So with menopause, what we expect is that the follicle stimulating hormone and the luteinizing hormone will be elevated. They go very up, high up there. Normally, it's supposed to be like in figure of, it's supposed to be a unit figure. But you now have it going up in tens of figures. Sometimes you get to 70 something, which is clearly showing that there is no more eggs at all. The work of this follicle stimulating hormone is to help, and the luteinizing is to help with ovulation. There are hormones that are produced from the brain. They come from the brain, telling the ovaries that, yes, we are starting up another cycle. Please recruit eggs in readiness for ovulation in case of pregnancy. So they tend to go a little high up when they are commanding the ovary, but they don't go as high as going above board. And then they immediately calm down when the eggs come out, because the estrogen that the eggs produce tend to help them calm down a bit. So these are the things we look at. So when it's so elevated, definitely is like is either the ovaries, the eggs, the follicles are not present because the ovaries has nothing to do and it's not responding, because it is when it responds that they calm down and it comes down. You understand? So there is also the estrogen estradiol. This tells your doctor how much estrogen your ovaries are making. These levels will also go down when it comes to menopause, which I've been explaining before now. Then the testosterone too. Testosterone, we know, is a masculine hormone. We also have some quantity of it in us as women. At this period, we notice that there's a little bit of increase in that hormone in perimenopausal period. A very fantastic investigation that we do is actually to look at the ovarian reserves. Ovarian reserves means how many follicles are left within the ovaries. And this is done by looking at the hormone, anti-Mullerian hormones, which is being produced within the ovary. Anti-Mullerian hormones and inhibin. So if their levels are completely reduced, then that means that there are no eggs present. We also want to do thyroid hormones, which is very important. It's a very important test to do alongside in making diagnosis of menopause, because at times it may actually be the thyroid disease and we are thinking it is menopause because of the age of the woman. So we want to check the thyroid hormones, and then we'll be able to juxtapose it with the symptoms that she had, and that will help us to decipher that it is not a thyroid disease, it is actually menopause. Next slide, please. Next slide. I hope I'm still very audible.
Very well, ma'am.
Clear. The side
Thank you. So do I need treatment? Maybe that's the answer. As I said before, some people straight to it. They wonder why people complain. They wonder why people exaggerate the symptoms. They wonder and they wonder. But some people don't find it funny. And thank God for our health system. In developed clients, you have them come and complain of everything and anything that changes in the body. But in this client, we just sit at home because we are worried about payments, about out-of-pocket payment that occurs in the part of the country. And then that means they keep up with the issues in silence, And at the time they are now presenting, it looks as if exaggerated symptoms come to the doctor and misdiagnosis can even be made. So it's very important that we actually come when we have some of these funny symptoms and that we can be calmed down, that it is your natural process. Embrace it, welcome it. And that is where we start treatment from. Menopause is a natural process. Many symptoms will go away over time. But if they are causing problems, treatment can help you feel better. So we have to actually ascertain that these symptoms and signs that we have picked up are something that you are not able to cope before we start to support. Because we don't actually also want to go the trail of medications if we are not convinced about the fact that you actually need them. Because some of these medications that we have also come back with their own side effects. The commonest one is the hormone replacement therapy. This is medication to help to replace hormones that the body is not producing again. We've talked about estrogen deprivation, along with its twin, progesterone. So what we just do is to replace those hormones with medication, and then the patient just starts feeling better. And one of it is that the benefit is that the benefit of its use must, as I've said, must outweigh the risk of its use. So it must be beneficial when we are prescribing it. And we usually avoid using it with people who have undiagnosed vaginal bleeding, because the truth of the matter is that once you commence those drugs, even menstruation can recommence, because it has a way of helping to refresh the uterus, that's the endometrium. It starts growing again, and then you see menses coming up. We prepare patients for these occurrences. So that means that it will not be appropriate to actually give a woman who is bleeding prior to its use. Something else may be going on within that uterus. And then we try to avoid it in families with breast, ovarian, or endometrial cancer, because they can actually help to aggravate the process. Side effect of it is that it can cause fluid retention, bloating, breast tenderness, nausea, headaches, depression, stroke, mood swings, because they are hormones as well, and even bring about acne and bleeding. So another one that we make use of, instead of going systemic, that means taking in these medications either by injection or oral medications, we may actually go locally, identifying the issues. And the major issues of the day may actually be loss of libido as a result of all the things I've said earlier. Because this is number one breaker of a home, of a marriage, especially when the man does not understand, and when even the woman herself does not know what she is going through. And before you know it, because sexual intercourse is not as it were before, issue starts to happen. So one of the ways we manage that is use of topical hormonal therapy by using estrogen cream. It can come as insert or it can come as the gel. And then there can be watery vaginal lubricants that can be used even during the act of sex, so that this will help. Because at the end of the day, if we don't engage the use of these things, the patient may present with vaginitis, because of abrasion, injuries that can happen during such procedure, which will make sex never interesting to the woman again. Non-hormonal medications are available, vitamin D. Hello, my slides are not displayed again. Hello. Hello.
We can hear you.
Hello. The slides, I need the slides. Yeah.
Please, it's like network through dimmer off. So just hold on a
Maybe
little.
I can quickly use that to change my position too.
Okay.
Okay. So we're taking a break. Maybe we can get up and stretch our legs a bit and then sit down again. Hello. So thank you for transiting with me. I finally went back in a better position. So I'm actually still waiting for my slides. So while we're waiting for my slides, I think I can still go ahead. Hello. Am I still audible?
Yes, you are, but it's not recording.
Okay. Okay,
So
you want me
somebody
to hold on?
Yes, Doc. Please hold on a little.
Okay. Okay.
Hello, doctor. If you have your slides, good evening, everybody. I think you can continue with your own slides.
Yes,
Just
I think so
tell the
as well,
person
but
that
I
the
was asked
network
to hold on
you are
because of
out.
the recording.
Oh, okay, yeah, that's okay. Thank you.
So I have my slides and okay, we're still waiting.
Doctor, but please, you can
Hello?
continue. You can continue, ma'am. Thank you.
Good morning.
Okay, I can continue.
Yes, please.
Okay, well, I'm actually almost rounding up as well. So, yes. So I was talking about the fact that I was already on treatment, and then I talked about the hormone replacement therapy, the topical hormonal therapy, the fact that we can use lubricants, and then there are hormonal medications that we also engage, like vitamin D, E, and vitamin K, calcium supplementation, and there's a drug we call gabapentin. We also use selective estrogen receptor modulators, but the top of all of this is actually lifestyle modification. Basically, there's really nothing we will gain so much without including lifestyle modification. For instance, hot flushes can be managed with drinking cold water, sit or sleep near fan, and dress lightly. Simple. Vaginal dryness with vaginal moisturizers or lubricant as mentioned. Then exercising regularly to sleep better, because I mentioned insomnia as a condition of menopause. To prevent such conditions, like also this around the period that chronic diseases also happens, like diabetes, osteoporosis, and all of these cardiac diseases. So exercises can also help around this period. Then Kegel's exercise. Kegel exercise is also important because it helps to strengthen the pelvic floor. So I'll leave that question. I'll leave it as a question. If it's going to be asked, I will explain then. Then stay socially and mentally active. Very important. It is not a time to actually sit idle. One should be engaged at one point or the other in order to deal and avoid being depressed, Then we avoid smoking and stop alcohol if that is actually some of the things we engage in. And we eat healthy to monitor weight gain and hot flushes. Spa, yoga, massage helps a whole lot. So those things are not just for the rich people, that is only people or people that are wasting money. It's actually medicinal when managing menopause and its issues. Then the hormone replacement therapy, is it a must? It is never a must, because most times after lectures like this, And people that recognize that, yes, it's important, they just come to the clinic and they demand for hormone replacement therapy. I said the benefits must outweigh the risk. I emphasize that actually. So the reasons why we may give hormone replacement therapy is actually to prevent the osteoporosis that comes with menopause at times, and then the treatment of the vasomotor symptom, that's the hot flushes, which is if it's becoming so unbearable, and also to help to treat vulvovaginal atrophy. That means vaginitis, and there are lots of complaints at home. So we can indicate that we want to use them, because the complications I've said before, endometrial cancer, breast cancer, ovarian cancer, especially in families that have such cancers, it's also prone to thromboembolic phenomenon. That means that one can have its blood clotting up within the vessel, which can lead to some form of conditions like stroke, heart failure, liver failure. These are very important things that we take note of when we put patients on hormone replacement therapy. And I've mentioned where we shouldn't use it at all. A patient that's having vaginal bleeding before, no way. History of cancer, no way. Active deep vaginal thrombosis, that means this person has varicose veins, and all that, or has history of such. Patient that has suffered pulmonary embolism before or has had stroke before, we avoid use of hormone replacement therapy. Then other things that are very important is that we should take our wellness seriously. We should do our annuals. And I usually say it's better done as a birthday gift. We know our BMI, body mass index, our blood pressure, our blood sugar levels. People say now, do you know your numbers? It's actually a question we ask. Do you know your numbers? My mammograms from the age of 40 years, abdominal pelvic scan, which is one of the screening for ovarian cancer. Though it is quite hectic, but it's not cheap, and you need an expertise for that to be done. So that means scanning is actually not a good screening tool. But one way or the other, we can pull out some money and get that scan done. Cervical cancer screening, endometrial biopsy, which is quite invasive, but then when necessary, it has to be done. Eye screening, for cataract and colonoscopy. These are things that we should engage in at this period. We shouldn't take our health for granted at this period, because the truth of the matter is that the body can be actually likened to a generator. I know that generator cannot work forever. Even our cars, our locomotives cannot work forever. We need to service them. So that is the point. The body needs servicing, most especially around this age. So is aging menopause? Is menopause aging? I'll leave you to answer that question. Multisystemic disorders that can happen to one who is aging is the heart, the bones, the intestine, urine, brain, urinary system, eyes, ears, teeth, skin, weight, sexuality, everything changes, everything ages. So should I cope or embrace it? The answer is please do embrace it. And the solution is just your lifestyle modification. Get used to a new life, reduce those sugars that you take, reduce those salt intake that you take, reduce all of these things. Just pay attention to your health at this point in time. Maybe in the younger age, you have engaged in very wonderful things. Just know that this is the age to actually reduce those things, and one gets healthier with it. So the diseases that come with aging, cardiovascular diseases, diabetes, cancers, osteoporosis, adult dementia, and eczema are some of the diseases that come with aging. So can they be managed? Of course, yes. Life must be prolonged. That is the work of doctors. We try to preserve life, but we are not God. And we ensure that even if there are these diseases, the quality of life must be at its best. And then when the diseases are actually there's palliative cares that we can give to ensure that the life at least is prolonged for some time. So we should embrace the reality. Really, aging is reality. And then it is a time that we should become much, 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 much more spiritual. If you're a Muslim, you Muslim more. If you're a Christian, you Christian more. If you're a pagan, you pagan more, Then do you know that even men go through menopause? We call that andropause, low testosterone. Yes, their testosterone, which marks them as male, actually at this point goes low. The testosterone of the hormone responsible for deep voice, muscle mass, facial and body hair patterns found in males. As men get older, the level of testosterone in the body and production of sperm gradually becomes lower, and they experience physical and psychological symptoms as a result of these low levels. So andropause is a condition that is associated with decreased male hormone, the testosterone. So what should they expect as men? There will be low sex drive, difficulty in getting erections. So we should also show our understanding towards our husband. Lack of energy, depression. So it's not only the woman that suffers it. Irritability and mood swing, loss of strength or muscle mass. Height also drops, they become shorter. Then there's also breast discomfort or even breast swelling. There's increased body fat at this period, and also they also can suffer sweating and hot flushes. So in conclusion, nothing can be done to prevent menopause, and also nothing can be done to prevent aging. Nothing can be done to postpone it itself on the onset or to slow it down at all. It is a progress, and we should try to ensure that we embrace it positively. So thank you so much for listening.
Oh my goodness. Thank you so much. Please, can we come to the chat room and just appreciate Dr. Modupe for this brilliant presentation, in spite of the hassles of having to present whilst even in the car. You were so fluent, eloquent. You just and in my head, I'm saying, which day will I go to Lasut and go and meet Dr. Modupe? Maybe now she go examine me to know whether my own perimenopause, do I need HRT or do I do the normal ones? Thank you so much. And I think that while she was speaking, she was answering some of our questions. In my head, I was just saying, which kind of wahala be this? We start menstrual cycle problem. You are ending the menstrual cycle problem. I think that I don't care what the men are saying, that we are doing Mother's Day 5 times in a year. There should be Women Day, Menstruation Appreciation Day, Menopause Expectation Day. Like, they should celebrate us over and over, because to be a woman is not easy. It's not easy at all. And like you said, many things are coming, and I'm sure people have a lot of questions. So I will just take us into the Q&A session immediately. I have my own questions myself. Okay. But to do the honors of interviewing you, so Dr. Modupe, please, you still remain on the spotlight. I will just bring in the person who is going to moderate the Q&A, and that's no other person than the chairman, Medical Women's Association, National Chairman, Medical Women's Association, Outreaches, and Community Engagement Committee National Chairperson, and that is Dr. Ifeinwa Okeke. So Dr. Ifeinwa, are you there? I want to spotlight you so that we can get into answering the questions immediately. I'm sure that people have lots of questions to ask. Where is Dr. Ifeinwa? Why am I not seeing you? Okay, I can see you.
Yeah.
I'm trying to okay. All right. Welcome.
Thank you very
So
much.
you have the floor, and Dr. Modupe, you also be in the spotlight so that both of you can take she will ask you the questions and you will respond. Over to you, Dr. Ifeinwa. Thank you for doing this with us. Did I let you people know that Dr. Ifeinwa is also a member of She Reconnects? You see, we know they attract people who know service things. And for those of you who do not know, this is the person that remained breast for me. So that should tell you that she's my immediate elder sister. So it's nice to have you here. Please do us the honors of
Thank you very much, Dima. Thank you for
Q&A.
that introduction. Thank you so much. And Dr. Modupe, nice, but indeed, your Dupsy, gynae Dupsy, everything that you pick. Well done, ma'am. So now we'll go over to the Q&A session. Thank you, everyone that has been on this call also. We love and appreciate you. And so we have a question here, which says that the perimenopausal symptoms are diverse and affect almost all body systems. How do one distinguish these symptoms from clinical diseases? Would you like me to take all the questions, or you want me to take a question and do the answer?
I think it's better to take the question and do the answer because I can miss out not answering all, you know?
All right, ma'am. So this first one, you go there. Thank you.
Yes. So I would like to say, and I'm sure it can address some of the questions already on the platform, that the age where menopause, perimenopause begins, that's the age, like, as I said, between the ages, when it perimenopause, 40, 45, and we expect menopause from the age of 45 to 55, with a peak age of 51. That means by 51, you should be, if you have not seen it, you should be expecting it. And by the age of 55, 56, it is not here, that you are still menstruating, it is important to investigate why your menstruation is going beyond the age of 55. One should not sit at home on that. So in addressing that question, that is actually also the age where you have, if you have some family history of some of these chronic diseases, then they tend to show up at that same age. We talk about hypertension, we talk about diabetes and all of that. And they also come with their complications on so. But on the other side as well, I said it's a period of estrogen deprivation. And I've said estrogen is very essential for every system in the body. I highlighted what happens when the body is estrogen deprived, meaning that the follicles are disappearing, they have disappeared, and they are the major producer of estrogen. So at the end of the day, they then as well contribute to some of the systemic conditions that we may have, you know. So it could actually help to aggravate the condition more, you know. So the point is that the emphasis on lifestyle modification at this point in time, you know, immediately you clock the age of 40, we usually say life begins at 40. What it means to us is to take our life more seriously, our health more seriously from that age of 40. Thank you very much.
All right, thank you very much. So since life begins at 40, we are being urged by Dr. Motibe to take our health and take our life seriously. Thank you very much, ma'am. And the next question goes this way. How do I address common symptoms associated with menopause, particularly hot flushes and crawling sensation?
So I actually made mention of it in the course of the presentation, and I said that once it's been identified as hot flushes, you know, as I said, in this part of the world, most of the time we sit at home. It's actually important that a health professional help you in identifying the symptoms. And so once it's identified, you know, it's easy to take care because it's just like knowing that as soon as you know your menstruation is there, you just start feeling cramps. I think it happens to us like that. You just start feeling cramps, you know. So once you are aware, you can cope. You know, once you know that it's my menstruation and I'm cramping, you know I can cope. You just go about your activity for the day. Same with the fact that you now know it's hot flushes. And one of the ways is just ensuring that you make your room well hydrated, aerated rather, and ensure ventilation, you know. And then you should also know that obviously you should have a fan. If you are the fan of air conditioner, you know, then you can go ahead to put it on. And then you wear light clothing. You know, it's not a time to be in winter. You know, it's a time to wear winter clothes and all that. So as simple as that. But we usually pay attention to it because at times it can be crazy for some people. You know, that is why we say you should attend the gynae clinic. There is actually clinics for geriatrics that family physicians actually take care of. But then even in the gynecological aspect of it, we have our aging clinic, menopause clinic as well. But they are not so common in this part of the world. But we have them situated in teaching hospitals, you know. So you come in. Most times when you go to those clinics, you see that the attendance is poor. People only want to come and see you for issues of I want to get pregnant and all of that. So these issues are things to actually deal with as well. Don't sit at home. Thank you very much.
Don't sit at home when you have these things happening to you. All right. Please, Dr. Motukwe, does perimenopause cause inflammation in the body? Since I stopped my period, my shoulder, arms began to pain me, An MRI discovered synovitis and bursitis. How do I handle this problem?
Sorry, I didn't get that question very well. That
Onize,
MRI discovered what?
Discovered synovitis and bursitis.
Please, you
How
need
do
to
I
learn how to wash
handle this
properly.
problem?
I'm not asking you to come back and wash it. I'm telling you that when you do it once, you do it properly. I know you are tired.
You
Can
can
you hear me,
always,
ma'am?
Stay
you can
muted.
imagine.
Can we stay muted? Because I am trying to, yeah, I'm working to mute everyone so that we can really get what Dr. Modupe is saying. So please, I will appreciate if we stay muted if we are not speaking. Dr. Ifeanyi, please go ahead and repeat the question. I don't think Dr. Modupe heard you.
No, I'm okay. I'm okay with it. I'm okay. I just wanted to
Okay.
hear what the MRI was, and she has repeated it. So I
Okay.
want to say at this point that we are not saying that once we get to that age of menopause, that indeed anything that is now wrong with you at that point in time is menopause that is causing it. So please don't let us get it wrong. You understand? The point is that something is wrong, please present to the doctor. And the doctors, first set of doctors you should see are actually the family physician. And then they are the ones that do the referrals. As soon as they see that you need to see a gynecologist, then they will refer to a gynecologist. We are no more in the age where a doctor is doing everything. It's in the age now that we can ask for specialists, you know, and doctors also are aware of the fact that they need to refer when the time comes. So I would want to say that I don't think a sinusitis is because of menopause, you know, but then just go and follow up with your care with whichever doctor that you're seeing. Thank you.
Thank you very much, Dr. Modupe. Can a woman still get pregnant when she has entered menopause?
Yes, I think I also addressed that. So it is never, ever, ever, ever possible to get pregnant, spontaneous pregnancy at menopause. As I've explained, menopause means the egg has finished. There is no more egg in you as a woman. So what will the sperm see to fertilize? Obviously, nothing. Nothing at all. So natural conception is not possible again. But to address the question of can a woman get pregnant at menopause, the answer can be yes, especially in this age, because we are talking about assisted reproductive technique now. And in this kind of situation, we talk about the use of donor egg. Donor egg, along with your husband's sperm, if the sperm quality is good, they fertilize it and put it within your uterus, and that is pregnancy. And at that point in time, with the use of various medications, they will help you to be able to carry that pregnancy to term and deliver, and most likely to even breastfeed. Do you understand? So natural conception, no. Assisted conception, yes. Thank you.
Thank you very much. What are the causes of severe heaviness and pain in the breast prior to menstruation? It's taking us, but it's okay.
Yes.
Right.
So I don't actually feel that you feel evidence and tenderness in the breast towards menstruation. I mean, towards menopause, because I've said before that the estrogen is dropping. When there is enough estrogen in the body or a high level of it, you feel fullness in the breast and even some form of tenderness when it is touched, you know. But when I said it's being deprived, you see that the fat constituents reduces, and that's when they describe the breast as a slipper's breast, flat on the chest. You know, it goes gradually to that size. You even see that your bra size is reducing, so to say. So usually I don't think you feel the fullness and all that. If you are worried about your breast, even though there is no lump, see your doctor. See your doctor. See your doctor. Thank you.
Okay, thank you very much. Um, the next question says, what is your take on HRVs at this time?
My take on HI.
HRTs, hormone replacement therapies.
Okay, I think I really talked about it during the presentation. Yes, hormone replacement therapy. Yes. I think I really emphasized it during the lecture. The only thing I want to say about it is that you shouldn't commence that therapy by yourself. It's as because a lot of things happen in this part of the world. You can easily go to the pharmacy and then they can sell these drugs for you because now people go to do some form of chat GPT. They are usually online. They go to consult Dr. Google and all that. So it's usually not safe to prescribe or use by yourself hormone replacement therapy because I highlighted some of the complications. So we usually screen women before we commence this medication. Screen for the fact that it is indicated, that it is needed. And then after that, we also ensure we do follow-up. And it's not a drug that you take for forever. It's a drug that will stop. We may even stop at interval and recommence. So even screening may be done before it is commenced. So it's important that you are guided when you are using hormone replacement therapy. That prescription should actually come from your gynecologist. Okay? So we have to first of all see. In fact, when we are managing patients with menopause, we want to exhaust psychotherapy. We would like to embrace psychotherapy first before we take hormone replacement therapy as an option. Thank you.
Thank you very much. The next question goes this way. Transdermal estradiol patches are also an additional safer option in comparison to, okay, the person is just making a contribution. Okay. The only downside is that it is relatively more expensive than pills, and absorption rate may be different. Okay, thank you very much for
So
that.
those are some of the hormone replacement therapy. Thank you so much. Yes,
Yeah.
thank you.
And then yet another contribution. Bioidentical HRT are now available as compared to the popular equine-based HRT. Bioidentical HRT are scientifically proven to be safe with little or no life risk of cancer development. And then someone is giving us thumbs up to say yes, just like Dr. Tupe said, lifestyle modification is very important. And then there's a question here that says, is colonoscopy cheap to be done?
Is it cheap?
To be done. Colonoscopy.
Yes. So when we talk about colonoscopy, we talk about even its availability before talking about its cost, you know. So it's not as readily as available as some investigations that you have. It is usually carried out by gastroenterologists and all that, you know. So it is available. And in our own area in Lagos, obviously, we have all of these things well represented in Lagos. So it's available. It's indicated, especially for families who have cancers relating to breast, ovarian, endometrial. We say you do your screening and the male members of the family will also do their colonoscopy as well. Even the females, you do the colonoscopy too. Very important. That's a very good question. Thank you very much.
All right, thank you very much. And then we have everyone here saying, well done, thank you, thank you, thank you. Thank you so much, Dr. Ben. It's been a wonderful time, and thank you for taking the questions also. I just want to read this. Someone says here, thank you so much for this wonderful session. Please, my question is this. Being on some form of family planning, the menstruation ceases while using the contraceptive. Can such period be likened to premature menopause? Does it have any effect on how soon the phase can be experienced? Thank you, ma'am.
Okay. Yeah. So I also mentioned it as well that those are some of the myths that we have with use of family planning. There's a lot of myths on family planning. People are always very scared to go for family planning because of what people say, essays, which are not true. You know, we actually set up family planning clinic to meet experts that will counsel you on the process, help to pick a suitable method for individual. You know, these are things that we put into bed. But people emphasize so much on myths concerning family planning, and then exaggerate the side effects. For instance, one of the ways that we know that some of these hormonal contraceptives that we use for family planning is effective is the fact that your menses may not be coming regularly or may not even come at all, because the workings of this method is to prevent ovulation from occurring. Once there's no ovulation, then there cannot be menstruation. So what it just does is that it suspends ovulation. That does not mean that it is menopause. As I said earlier, menopause means that eggs are finished. In this case, your eggs are very much present, but the point is that they are not being they are not brought out. Their ovulation is prevented, and that means that if there is no ovulation, there will never be menstruation. So that's the workings of those hormonal family planning methods. So it's never the same as menopause.
Yeah. All right, thank you very much for this. Please, what's the earliest age the menstrual cycle can stop flowing and the latest age it can stop? Does genetics affect this age, or when a person started a period, take this as well?
Yes, that's a very good question as well. So I think I also said it. We should be expecting menopause from the age of 45, and it should be it should occur at least, at most by 55. Anything beyond that age, then something else is happening within the uterus. It has to be investigated. Okay. Then the second part of the question is also that you said I didn't get that. Okay, age. When menopause started, when menstruation started, does it mean that if you start much earlier, then that means menopause will also start early? Perhaps. If you started much later, then menopause will commence much later. Perhaps. But one of the strong figures is that when you want to actually predict the time of your menopause, just go back and look at your mother, your elder sisters, the female members of your family. Then you could actually predict when your own menopause will begin. So that's how I'll leave that question. Thank you.
Time is actually well spent, but let's just take 2 more questions, please, facilitator. What causes like a pulling in the breasts, like your uterus is contracting during ovulations and you are perimenopausal?
Okay. I think this breast must be doing mammogram every 2 years. That is what we say for 40 years and above. So if you are worried about your breast, please kindly go for your mammogram. Maybe I should also ask a question. When was the last time you did your mammogram? Thank you. That's how I want to answer that question.
Okay, thank you very much. Over to you, Digma, and thank you for the opportunity to anchor the Q&A session. Well done, everybody.
Thank you very much.
It's as if we should just stay here. Where is Olabukun? We need to give a resounding applause to Dr. Modupe Adedeji. Thank you, ma'am. Thank you, the entire team at the Medical Women's Association Lagos branch, the National Outreaches and Community Engagement Committee chairperson, chairman. Thank you so much. We cannot thank you enough. And it's been a great time. I'm sure for many of us, a lot of our questions have been answered, and we are ready to take on this season in our life as part of life, as a natural occurrence, and do all that we're required to do. For me, this is me being vulnerable. When Dr. Modupe asked, when was the last time you went for a mammogram? My sister, I can tell you, is over 5 years ago. So that is also for me to say, Dima, you need to go to the hospital and do all of this checks. So for the rest of us, when was the last time we did medicals to check all of these parts of us? So thank you, everyone. And I'm sure you had a great time. If this was an impactful time for you, you can just imagine how many other, stuff that you can enjoy with the She Reconnects. Just to add, so that we can all go, I have dropped the link. If you want to be notified of the activities and the webinars that we do as She Reconnects community, please click on that WhatsApp link. Like I said when we started, for those who were not here, She Reconnect Africa is a sisterhood of women of African descent. And what we do there is to share connection, compassion, and courage. How do we do that? Every month, we nominate a topic, whether we're talking about being female,
No, don't challenge my doctor. Èmi dẹ̀ ni mi ò gbọ́.
We can't hear, please. There's no audio.
Oh my goodness. Hello? Please confirm that you can hear me.
Dima, I can hear you.
Okay. So Bella, you should have concluded this. Network threw me out. Bella Global. So thank you, everyone. This is just one of the things we enjoy at She Reconnects. I was just about to tell you, based on what Dr. Modupe taught us, taking care of yourself is very important. And for us as a African female community, we also prioritize that. So We will be having our next Shikation, an all women only weekend getaway in Greece. And that is going to be in the last weekend of April 2026, 28th of April to the 2nd of May. She Reconnects Tribe will be having our third Shikation. Just us women letting down our hairs, going to somewhere to just spend time. 2 years ago, we were at somewhere in United Kingdom and it was amazing. This year, we were at Marrakesh, Morocco, and we had a great time. Lots of bonding time, vulnerable moments, sharing strengths. And next year, we will be going to Greece. So if you're interested in joining this all-female African women community where we enjoy stuff like this and reconnect to our true heritage, please click on the WhatsApp link and we will be glad to have you and tell you more about us. So to wrap up, I want to once again thank the entire team of the Medical Women Association of Nigeria, Lagos branch. We want to also thank their president, Dr. Ime Okon. We want to appreciate our amiable speaker, Dr. Modupe. Please, thank you. In spite of your tight schedule, you were here and you really delivered. We also extend our thanks to the national chairman of the M1 National Outreaches and Community Engagement Committee, my very own sister, Dr. Ifeinwa Okeke, and of course, the national president, Dr. Zainab Kwaru Mohammed Idris. And Sisters of Reconnect, I hope that you share the same sentiments with me, that we should be doing this. So maybe by the time we come into 2026, quarterly, we are going to be having these amazing women. We need to also talk about mental health. We need to talk about our reproductive system and all of that. So from me and my co-founder, Olabuku, who is unavoidably absent, we want to say thank you for sharing this time with us. And we hope to see you in the community. And together, we will continue to connect, share courage, and share compassion as African women. And I look forward to seeing you at Shikation 3.0 Greece 2026. Have a fantastic night rest and God bless you.
Thank you. God bless you too. Value added.
Thank you. God bless you.
Thank you. God bless you. We're grateful. Very good.
Thank you. God bless you and good night.
Thank you, Ma. God bless you.
Very interesting. More insight.
Good night, everyone. God bless you. Nice being with you.
I'm classic, I'm modern, I live by my own design. I'm cherry, I'm lemon, I'm the sweetest key lime pie. I'm electric, I'm bass, I'm the beat of my own drum. I can make it goosebumps race with the joysticks on my thumb. Only love can get inside me. I'm moving in my own timing. Voice of the future, speak to me kindly. Ask for what I want, and somehow it find me. Somehow it find me. Somehow it find me.